you know, tobacco use, and particularly cigarette smoking, continues to be the single most preventable cause of death and disability in the U.S. and across the globe. So one of the most important interventions clinicians can provide their patients who smoke is effective smoking cessation therapy, which includes behavioral intervention as well as effective pharmacotherapy. Hello, my name is Dr. Taylor Hayes from the Department of Medicine at Mayo Clinic, Rochester, Minnesota. I'm pleased to provide an overview of our article on behalf of myself and my co-authors that will appear in the Mayo Clinic Proceedings. The article is entitled Frequently Reported Adverse Events with Smoking Cessation Medications, Post-Hoc Analysis of a Randomized Trial. The study was funded by Pfizer, who also funded writing support. The FDA approved smoking cessation pharmacotherapies, including nicotine replacement therapy, or NRT, bupropion, and varenicline, significantly increased the chances for a successful quit attempt. So clinicians need to take every opportunity to provide effective therapy, including the utilization of medications, and improve both the utilization and adherence of these medications by their patients. So one of the barriers to effective smoking cessation pharmacotherapy is concern over the experience of adverse events. And there are misperceptions which exist about the frequency and severity of adverse events related to smoking cessation medications, and I believe these misperceptions are held both by patients and many clinicians. So in our paper, we provide a detailed analysis of adverse events experienced by participants in one of the largest randomized controlled trials of smoking cessation pharmacotherapy ever published. This is the Eagle study, which is a phase 4 randomized double-blind placebo-controlled trial assessing the safety and efficacy of varenicline and bupropion for smoking cessation in patients with and without psychiatric disease. The Eagle study captured detailed individual adverse event data from participants related to both the observed, volunteered, and solicited adverse event experience. Our article is a post-hoc analysis of the Eagle safety data designed to compare the incidence, the severity, and the clinical course of the frequently reported AEs following treatment with varenicline, bupropion, and NRT patch. In the Eagles trial, 8,144 smokers were randomly assigned to varenicline, bupropion, and NRT patch for 12 weeks of treatment phase and followed up for an additional 12-week non-treatment phase. And in our report, we analyzed the treatment emergent adverse event reports from the first to the last day of dosing of study drug, plus 30 days. We measured the incidence, the time to onset, and the duration of the frequently reported AEs, defined as those events occurring in 5% or more of participants in any of the treatment groups. And we particularly focused on the adverse events that were more frequent in the active treatment groups compared with placebo. We looked at the risk differences for adverse events for varenicline and bupropion compared with the NRT patch because we felt that this was the most clinically relevant comparison. So with that as background and introduction, let me review with you some of the important results from the study. First of all, across all the treatment groups, severe intensity AEs were experienced by fewer than 1.5% of participants, and treatment discontinuation occurred in fewer than 3% of all participants across the treatment groups. We did identify 8 frequently reported AEs that differed significantly in active treatment compared with placebo. The most frequently reported AEs for each active medication is as follows: nausea in those who receive varenicline, insomnia in those receiving bupropion, and abnormal dreams in those receiving NRT patch. Compared with the participants who received NRT patch, the incidence of nausea and fatigue was greater in those who received varenicline. Insomnia and dry mouth was greater in those receiving bupropion, and abnormal dreams was lower in those who received varenicline or bupropion compared with the NRT. The incidence of 2 frequently reported neuropsychiatric AEs anxiety, and irritability did not differ between varenicline and NRT overall or when the results were stratified by psychiatric and non-psychiatric cohorts. Regarding the timing of the AEs, the median time to onset for the most frequently reported AEs was 5 or more days after starting therapy, and the median duration was 41 days or less. So here are some of our conclusions. So the findings, first of all, demonstrate the high tolerability of varenicline, bupropion, and NRT patch in a large population of smokers. Our results are consistent with previously reported findings demonstrating the safety of the approved smoking cessation medications. These results also provide clinicians with information regarding which AEs to anticipate, the timing of the common AEs, and most importantly, reassurance that these medications are safe across a broad population of smokers. The hope is that our results can help to reduce patient barriers to treatment by promoting medication adherence and increasing the chances of successful quit attempts. It's also important to be mindful of some of the limitations of our study. First of all, our trial participants did receive weekly follow-up and brief behavioral counseling therapy, which is something that generally can't be replicated in the clinical setting. The majority of the patients in the study identified as white, and so our results may not generalize to other ethnic and minority populations. And finally, the analyses included all as treated participants, and we didn't exclude those people who discontinued treatment. However, we felt the impact of not excluding these data was minimal. Overall, the results provide reassurance about the safety of the approved medications for smoking cessation treatment. And we encourage all clinicians to recommend effective therapy for smoking cessation for all smokers, and that includes combining behavioral therapy with approved pharmacotherapy. Thank you for listening, and we hope you enjoy the article.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.